Hi, welcome to PCH Finders video series. I'm Hans-Dieter Sweeney. In this video, I'll be covering the level of care determination. Now, what is level of care determination? Well, it's the assessment of the management of care of an individual. The level of care is determined by the extent of personal care necessary, care provider expertise, number of employees needed to provide that care, and how much staff time is required to provide care for your senior loved one. It's determined at the time of the admission process to a personal care home or assisted living facility, or while formulating a negotiated care plan. The monthly care rate charged for your loved one is based on the level of care your senior family member requires. Now, I'm going to provide you the 5 levels of care as determined in the industry standard. Each level is distinct and increases in complexity of care. With that, as each level increases, so does its cost of care. Now, although each level carries its cost, the costs are not strictly set and may be negotiated or changed by the care residents. This often benefits family. Now, let's begin with level 1. Now, this is independent or supervised. A level 1 resident only needs a place to live, laundry completed, room cleaning, and meal service. The level 1 resident needs little provided other than 1 or 2 minor exceptions that can be agreed to between the caregiver and family member. Now, care increases beginning with level 2, and this is minimal assistance. This resident is ambulatory, continent, and oriented to date, place, thing, and time. Assistance is minimal. The resident is fairly independent and has no significant medical problems. Assistance with medication reminders, nutrition, hygiene, and activities of daily skills may be needed. Level 2 services include medication management, monitoring for general health and well-being, blood pressure monitoring, weight and nutritional assessment. Some personal assistance may be necessary. Now, level 3 is substantial assistance. The resident has moderate medical problems and is able to perform some self-care, but may need reminding and general assistance. There may be some memory and orientation loss. Assistance with dressing and grooming tasks may be needed. Services include biweekly assistance with bathing, hygiene, and grooming supervision, nutritional intake, and incontinence management. Level 3 residents might need a 2-person assist to transfer occasionally. Level 4. This is major, extended, or intensive assistance. Extended care includes residents who are non-ambulatory and have bowel and bladder incontinence. They require more assistance with medication management, eating, bathing, toileting, dressing, and transferring. Level 4 residents also have advanced dementia or other debilitating illness. Now, intensive care, and this still includes level 4, intensive care residents include nursing care for catheterization, dressing changes, blood glucose monitoring, and other diabetes care requiring services of an RN and nurse delegation. Other care needs include a 2-person transfer for heavy lifting. A Hoyer lift may be required, for example. The intensive care resident is non-ambulatory and has advanced dementia or other debilitating illness. Level 4 also includes night wanderers, abusive or violent residents, or those needing two-person assistance in transfers that may be beyond care in an assisted living home. Also included are residents who need a special diet prescribed by their doctor. Now, we get to level 5. Now, this is the highest level of care. These residents are facing a life-threatening illness with no cure. Now, hospice provides for special care needs of the dying with emphasis on pain management to allow these residents to live each day pain-free and to the fullest until death. However, keep in mind that hospice has changed and it is no longer defined as a definitive death sentence. It's not uncommon for people to improve and move out of hospice and into home health. The hospice program is ordered by the resident's doctor. Doctor's orders are for skilled, compassionate nurses who utilize pain control and comfort measures. Hospice workers coordinate all resident care with the family, loved ones, responsible parties, or professionals in personal care homes or assisted living facilities. Some of the services provided include feeding, positioning every 2 hours, changing adult diapers, bed baths, etc., as needed for well-being and comfort until end of life. Now, I know the levels of care determination can seem confusing, but I hope this has provided some insight to how care levels are determined and where your senior loved one might fit. Now, visit our website for the Levels of Care Determination Guide and other helpful tools you can download and print. We'd also like to hear from you. Send comments and questions to PCHFinders@gmail.com. Thank you for your time and interest. If you have any questions, feel free to call, send us a note, an email. We'll be happy to respond. And until the next video, bye-bye.